Did you know that one of the most deadly diseases in America can be prevented? The disease that I'm talking about is obesity, but more importantly, the cure that I'm talking about is exercise. Exercise has largely been taken out of the American lifestyle. Elevators, escalators, and of course cars have completely eliminated physical activity from everyday life. The Center for Disease Control estimates that 1/3 of American adults are obese. While other factors are in play, exercise can have a positive influence on this disease and many others. I have been a part of an exercise program for the better part of the last year. As a result, I have seen many improvements on all aspects of my health. Including exercise in everyday life is an essential part of living healthy. As previously stated, exercise is an essential part of living a healthy lifestyle. While there are risks involved with injury as a result of exercise, the benefits far outweigh the risks. Multiple conditions can be positively benefited by a regular exercise regimen. Coronary heart disease is one of the most deadly diseases in America today. The American Heart Association describes it as the lining of the walls of the arteries with plaque as a result of intaking too many calories and high cholesterol and fatty foods. This impedes the blood flow through the heart and can result in high blood pressure. Also, if this condition is allowed to persist without being treated, it can result in heart attack, cardiac arrest, or stroke. Normal exercise routines can positively benefit all of these conditions. In addition to cardiovascular health, exercise has also been seen to play a positive role in not developing cancer. The American Cancer Society has stated that people who live more active lifestyles are at a lower risk factor to develop colon cancer. Women who live more active lifestyles are least likely to develop breast cancer, which is the second most fatal cancer in women. Another disease that is plaguing the United States is type 2 diabetes. Type 2 diabetes is a pancreas deficiency with the body's ability to break down glucose. Type 2 diabetes is associated with lifestyle choices and excess body weight. Exercise routines can help manage excess body weight and prevent type 2 diabetes. Not only can it help prevent type 2 diabetes, but it can also help manage it by supplementing the body's process for breaking down glucose. Another physiological advantage to exercise is longevity. People who live active lifestyles are 40% less likely to die early than those who are inactive. Not all benefits of exercise are physiological. The American Psychological Association has found inpatients with exercise programs having benefited mental states than those without exercise. Kirsten Weir of Monitoring Psychology Journal calls this the exercise effect. Studies of patients involved in this exercise effect have found patients to have an enhanced mood of others without exercise. The release of endorphins during exercise has been found as a beneficial supplement to the treatment of depression. The endorphins and norepinephrine released during exercise mimic the effects of the drugs used to treat depression without the negative side effects. Also, serotonin that's released during exercise has been proved to be a positive stress reliever. While most Americans are aware of all the benefits of exercise, more than 25% of Americans still report no physical activity as a part of their daily lives, according to the CDC. People often jump into exercise programs that far exceed their ability level in an attempt to achieve results quicker. This is both ineffective and detrimental to forming a positive exercise routine. The key to developing a strong and stable exercise routine is starting slow, with low-intensity workouts a few days a week. The best workout plan is one that you can stick to. Starting slow not only helps you stick with your workout routine, but it also helps alleviate some of the risk of injury. It allows muscles time to repair and allows tendons and ligaments to stretch slowly to keep you from tearing them or straining them. A good start for a workout routine is for a low intensity workout is to walk 15 minutes a day, 3 days a week. Once you're comfortable with this routine, you can either increase the length of your workout or the intensity, such as going from walking to jogging. Another important part of building your workout routine is to incorporate leisure time activities into your routine. Lifting weights and running are great ways of exercise, but there are other great forms of exercise, such as playing tennis or golf, that are equally as effective in giving you exercise but are much more enjoyable. Exercise is never going to be easy. It's going to cause you to push outside of your comfort zone to achieve the results of the program. We all have our own genetic predispositions to exercise, so it is very important to set reasonable goals. Not everyone can be a professional athlete, so goals should be reasonable and personal. No other person should factor into your goal making. Results are not going to be instant. They could take as many as 8 weeks to see the first results. This should not be discouraging because this is the start of a long process and it's going to become a part of your routine. Personal health should be the goal of any workout program. Any effort made towards your goal and any progress made should be seen as an accomplishment. In conclusion, exercise is a process. It has involved a dedication and a commitment to goals, and results have proven that exercise is a vital part of a healthy lifestyle.